He spent 9 years as a patient inside Eastern State Hospital. But tonight, Katama Ross is a free man and talking to KXLY about important changes coming to Washington's mental health system. Good evening, everyone. I'm Aaron Luna in for Nadine Woodward. The state of Washington has agreed to settle a lawsuit filed by patients who say they were warehoused in mental health hospitals instead of getting the treatment they needed to recover from their illnesses. KXLY4's Chef Humphrey working for you tonight at the Spokane Interstate Fairgrounds, where a mentally ill worker walked away from a field trip in 2009 and led to lockdowns for patients at psychiatric hospitals on both sides of the state. Jeff?
And you know, our state hospitals are trying to pull off a very difficult balancing act, protecting the people who are too unstable to be walking around the fairgrounds with their kids, but also trying to help provide mentally ill people with the medication and the treatment they need to earn back their freedom. Well, up until today, those scales were tipping heavily in favor of public safety.
Crime check, what are you reporting?
So I'm reporting a patient went to UL. Unauthorized leave from the state fair.
In 2009, a killer found not guilty by reason of insanity walked away from an integration field trip. Philip Paul's fairgrounds escape was short-lived, but had a long-standing impact on the way Eastern State patients would be treated in the future.
And when the walkaway happened and the legislature told the hospitals to focus much more on public safety at the expense of recovery, it actually made public safety worse as well.
And that's because patients like Katama Ross, who is already 2 years into his treatment and had already earned the right to walk around Eastern State's grounds without an escort, were suddenly locked down inside the hospital.
Both laws have taken away the clinician's ability to treat us effectively. And when I say treat us, I mean give us hope for recovery.
In 2007, Ross beat two of his Pullman neighbors with a broom handle because voices in his head told him the couple were a threat to our national security. He was found not guilty by reason of insanity and welcomed treatment for his schizophrenia here at Eastern. However, after Paul's escape at the fairgrounds, Ross's patient field trips were canceled. Without those reintegration outings, doctors lost one of their best tools to assess Ross's recovery.
It set me back significantly in that the culture of the hospital shifted from very conservative to even more conservative, and that set me back, one could argue, 3 or 4 years.
And that's when Ross and 5 other patients filed this 2014 lawsuit alleging that politics were trampling patient treatment. But today the state announced it was changing its policies and that doctors would once again be in charge of deciding where and when patients had earned their extra freedoms. The new agreement may also be what's best for taxpayers.
And that focus is great for patients, it's great for staff who can now do what they went to school to do. And it's also great for the public because we're all safer when people with mental illness are treated.
Aaron, because of the lockdowns that happened after Paul's escape here from the fairgrounds, Viviano estimates that his client spent an extra 4 years at Eastern State Hospital that he really did not have to serve. Surprisingly, Mr. Ross says he is okay with that because the lawsuit he filed and fought successfully, he feels that that investment will make sure that hundreds of other mentally ill patients don't go through the same thing in the future. Reporting live at the fairgrounds, Jeff Humphrey, KXLY4.